Hello everybody, again it's your medic, the D.O.N Health Hub, and welcome to our today's session again. So if this is your first time watching our videos, you can support us by doing the subscription. You can share our videos, you like and you comment. So again, today we are here to talk about a certain condition that in this current society it tends to affect most of women. That's why I decided that I want to do a review about it so that they can be aware of whatever comes their way. So today I want us to talk about a condition called cervical cancer. So that is, we'll start from the definition, we go to the causes, we go to how it presents, that is signs and symptoms, we go to the diagnosis, we see the management, and how we can prevent this condition. What is cervical cancer? So when we say cervical cancer, it just refers to a malignant growth of abnormal cells in the cervix. When we say cervix, we refer to the lower part of the uterus opening into the vagina. So cervical cancer develops gradually over several years, and usually starting as a precancerous changes which can be detected through early screening. So that's why we normally advise, for this case specifically, we normally advise ladies to go for cervical cancer screening, because the moment you found that you have the you have the cancerous cells, you'll be started on certain medications that will suppress the cancerous cells until it ceases. But now, if you wait until it comes out as a cancerous now, as a cancer, then that by that I mean that on the later stages of cancer, so it will be too late. So we'll be started on the chemo or radiotherapy plus all other managements. But if you do the screening as early as possible, and if you're found with the cancerous cells, you'll be given medication to suppress the cells. And this also goes to the males or men. Also, they should be screened more often, so that when you're found with the cancerous cells, you can be given medications to suppress those cells as early as possible to prevent it from developing into more lethal stages. Now, having talked about the definition, now let's look on how this cervical cancer is being caused. So the main cause of cervical cancer is a persistent infection with a high risk of human papillomavirus, especially human papillomavirus that we have types 16 and 18. So there are several types, but the ones that cause the cervical cancer are type 16 and 18. So human papillomavirus, also shortened as HPV, is a sexually transmitted virus that causes abnormal changes in the cervical cells. So if the infection persists, these abnormal cells can gradually turn into cancerous. So that's why if you go for early screening and you're found with the cells, you'll be given medications to suppress the cells. Yeah, so we've gathered the definition and the causes. Now let's look on the risk factors. What are the things that puts us at risk of getting cervical cancer? Yeah, so number one risk factor, we have early sexual activity. By this man, we mean that starting the sexual activities at an early age. So how does this affect an individual? So you find that when you begin sexual activities at an early age, your cells, the cervical cells, are still immature and are more vulnerable to human papilloma virus. So that's why if you start sexual activities at an early age, you are at a risk of getting cervical cancer. Number two, we have multiple sexual partners. So this one cuts across even the married people, the unmarried but are in the relationships. If you have multiple sex partners, also you are at risk of getting human papilloma virus, which can expose you to getting cervical cancer. So you're being advised to stay faithful and have one partner. Yeah. Now, the third risk factor, we have persistent HPV infection. So if you're being infected with human papilloma virus most of the times, then also you are at risk of getting cervical cancer, because this is a virus that causes cervical cancer. So if it affects you most of the time, then you are at risk of getting a cervical cancer. Also, we have HIV and AIDS. We know that the moment you have HIV and AIDS, your immune system is weakened. So the body fails to clear the human papilloma virus. So through that one, you are at risk of getting cervical cancer. Also, smoking weakens the local immunity in the cervix, and when the local immunity in the cervix are weakened, then also you are at risk of getting the cervical cancer. And the last one, we have lack of regular screening. So you should do screening more often. You do it regularly, so that whenever the cancer cells are found, you are given a medication to help suppress them as early as possible. Let's talk about pathophysiology. So, in pathophysiology, we find that human papilloma virus infects the cervical cells at the transformation zone. So, this virus interferes with the normal cell control, causing the precancerous changes. So, when we talk about the cancerous cells, the precancerous cells, we know that these are cells that have abnormal cell division. They grow at a faster rate. So that's how the precancerous cells or cancerous cells behaves. So that's why here in the pathophysiology, I'm trying to say that now the precancerous changes occur, then after that one, there will be progressive abnormal cell growth, the abnormal cell multiplication, resulting into cancerous cells. Then after the abnormal progressive cell growth has occurred, now these cancerous cells now they start invading the deeper cervical tissues. Now they are moving from the site of infection. Now they begin to move to, they spread to the deeper cervical tissues. Then from there, they will be spread now to the nearby organs if now this cervical cancer is untreated. But if you do screening at an early stage, maybe when there is progressive abnormal cell growth, then you come to the health center, we do screening, and you found that you have the precancerous cells, you will be given the medication that I had already mentioned earlier to suppress these cells from undergoing the abnormal cell growth. That is the abnormal multiplication of cells. Then they will be suppressed, and the cervical cancer thing will stop at that stage. But now, if it is left untreated, now it will progress into later stages, where it will become more dangerous and more lethal. So that's where it starts to spread to the nearby organs if left untreated. So this process may take many years, which is why screening is very effective. Screening more often, so that when you're found with the cancerous cells, you're given the premedications to suppress it. So let's move to the types of cervical cancer. So we have two types, very simple. We have squamous cell carcinoma, and this is most common. This most common arises from squamous cells of the cervix, just from the name. The second type of cervical cancer, we have adenocarcinoma, and this one arises from the glandular cells of the cervix. So I want us to talk about the signs and symptoms of cervical cancer. And on the signs and symptoms, they've been divided into two classes. So the first class, we have early stage of the symptoms. And the second class, we have now the advanced stage of the symptoms, signs and symptoms. So on the early stage, now these are just it does not become more dangerous. So you'll feel nini, often it is asymptomatic, but may present with the following. There can be abnormal vaginal discharge. Remember, any discharge from the vagina is something which is abnormal. There should be no discharge. And you need to know the difference between secretion and discharge. So we are talking about the discharge. So abnormal discharge from the vagina. Also, there can be bleeding after sexual intercourse. So normally there should not be any bleeding after sexual intercourse. But now, if you find that you are in a situation where after any sexual activity, then you find yourself bleeding as a woman, then those ones may be signs of early signs of cervical cancer. So now on the advanced stage, now we have heavy or irregular vaginal bleeding. So you find that this bleeding will now progress into now the heavy one. You get the point. Then there can also be foul smelling vaginal discharge. There can be pelvic or lower back pain due to infection. There can also be pain during sexual intercourse. You should not be intercourse. Also, you can experience weight loss and anemia. There can also be swelling of the legs. Now, let's move to the diagnosis. So, when we say diagnosis, we refer to the diagnostic procedures that are used to help us in the realization whether an individual already has the cancerous cells or clean. So, the first diagnostic type, we have something called a pap smear. So pap smear is just a procedure that helps us in the detection of abnormal cells. By abnormal cells, I'm referring to the cancerous cells now, the ones that have the abnormal multiplication. They grow at a higher rate. So the second one, we have via villi. This one is the visual inspection with acetic acid. And simply, this one is a screening method. So we usually take iodine and acetic acid. We smear iodine, then spray acetic acid at the cervix. So when an individual is already having the cancerous cells, the patches will appear at the cervix, patches of the cancerous cells. Those will confirm that an individual is having the cancerous cells now of the cervical cancer now. But if there's no patches, if just clean, then automatically you don't have. Then the third one, you have human papilloma virus testing. This one detects high risk human papilloma virus. Also, we can do the cervical biopsy. Now, this one confirms diagnosis. You know, if you do a biopsy is done by, you take a small piece of the unit or place where you want to test, then taken to the lab for confirmation of the cancerous cells. So that one, it confirms the diagnosis. Then you can also have imaging tests like the CT scan, MRI. Now these are being done for staging. After you're found with the cancer now, the cancerous cells, and yes, you've been found with the cancer. Now we want to do your staging so that the treated can be commenced immediately. So we do the imaging, this imaging test to help us in the staging of your cancer. So let's move to the management. So on the management, we have precancerous lesions. We can do cryotherapy. Cryotherapy is a procedure where we freeze the abnormal cancerous cells. So we freeze them to prevent them from growing. We interfere with that abnormal cell growth. So cryotherapy is just a simple procedure to help in the freezing of those abnormal cells. Also, we can do this a procedure called LEEP. It's an acronym, LEEP. So this one helps in the removal of the abnormal tissue. Now, where those cancerous cells have grown, we can do this LEEP procedure to help remove those cancerous cells. So that one is under management, and management is divided into, we have precancerous lesions and invasive now cervical cancer. Under invasive cervical cancer, the first one is surgery. Now, mark my words. Now, surgery is being done at an early stages of cancer. So, the moment we realize that you have the cancer cells, so surgery will be done now at the site where there is abnormal cell growth. But at later stages, we cannot do surgery. So it's being done at an early stages. Then the second one, we have radiotherapy. This one helps in the killing of cancer cells now. Radiotherapy, we use the radiation. Yeah, use the radiation to kill now the cancer cells. Then chemotherapy now enhances the effect of radiotherapy. So by chemotherapy, we use just the cancer medications to help enhance the effect of radiotherapy. So they go in hand, radiotherapy and chemotherapy. And now the last one, we have the palliative care. So this is just a symptom relief in an advanced disease. Now at later stages of cancer, where now this one has become more dangerous, we can do the palliative care. This one is just to, by palliative care, I mean we are taking care of the symptoms now of the cancer, but we are not treating the cancer. Yeah, so that one is palliative care. So prevention also divided into two subunits. We have primary prevention and secondary. So under primary prevention, we have the human papilloma virus vaccination, and this vaccination is something that I forgot to mention earlier. Screening is done from the age of 25 and above. But now the vaccination, in the case of prevention, you can be started on vaccines as early as 9 years, from 9 to 14 years, then up to 26 years you stop the vaccination. Then from there, now you can begin now the normal screening, but you cannot be screened under the age of 26 years and below. So then the second one, under primary prevention, we have safe sexual practices. Yeah. Then secondary, we have regular cervical screening. You should do screening more often. This one I've mentioned several times. Then also, this one will also help in the early detection and greatly improves survival, because if it's detected at an early stages, there will be suppression of the cancer cells. The growth will be suppressed and you'll heal. But if you wait until this now comes out as now a cancer, then there will only be management, put on palliative care, and it will be worse. Yeah. So on the nursing roles, the things that we can do, there can be health education on screening and vaccination. We should create more awareness about screening, how it helps, the importance, how it helps, yeah, and vaccination, so that we encourage more mothers to bring their children for vaccination at an early age before they reach screening. Also, early identification of the symptoms. Remember, I already talked about the symptoms earlier. So we should know some of the symptoms of cervical cancer at an early stage, so that when you realize you have one or two, you go to the closest health facility to confirm whether it's something else or they are the real symptoms of cervical cancer. So if you find that you have the symptoms of cervical cancer, you are put on medication as early as possible, so that we suppress the growth of these cancerous cells. Also we can do the emotional support and psychological support. So this one will help also in doing away with the depression. Then there can be referral and follow-up care being done. So I guess that's all about our today's topic. That was cervical cancer. We've covered everything about it, and it came out very clearly. So you can share our video, like, comment with others, and as we wait for the next lesson to take on another topic. Thank you.